It's with great pleasure that I welcome you to the European Nursing and Midwifery Week 2025. This annual celebration, which spans from 5th of May, the International Day of the Midwife that we celebrated yesterday, to the May the 12th, the International Nurses Day, is a testament of unwavering dedication and resilience of our nursing and midwifery professionals. Now, we are thrilled by the numerous local and national events of our members are organizing across the European region. And these celebrations are especially significant as Europe and indeed the world continues to navigate unprecedented challenges, including political and economic instability, natural and man-made disasters, climate change, and mass migration. Every day, our dedicated nurses and midwives confront these issues, which impact on our health systems and most crucially, the communities, patients, and the families who depend on safe quality care. This vital work can be incredibly demanding, and we deeply appreciate the commitment of every health professional in maintaining the safety of our services. Therefore, it is essential that we come together to celebrate and collectively strive to make a necessary impact, whether through political influence, supporting our professional organizations, or providing direct assistance. So in this spirit today, one of our the most current webinar on our series that has been going on now over 2 years, we have organized with the WHO European region, European Federation of Nurses, EFN, and European Nurses and Students Association, ENSA. This event will bring together nursing and midwifery experts as usual, policymakers and advocates to discuss the critical issues of nursing availability, well-being, and the future direction of our profession. I am honored to have such a distinguished lineup of speakers who will follow, who will share their insights and solutions on topics ranging from workforce planning to mental health support. And I encourage you all to join this enriching and thought-provoking discussions. As we celebrate this week, let us come together to recognize the invaluable contribution of our nurses and midwives and pledge our continued support for their well-being and professional development. Together, we can ensure that our healthcare systems remain resilient and responsive to the needs of all. So I wish you truly meaningful and inspiring European Nursing and Midwifery Week 2025. Let us make most of this opportunity to connect, learn, and grow as a united community of healthcare professionals. This webinar later on will be moderated by Steve Pitman, but firstly, I'm going to welcome and invite Margrieta Langins, the Nursing and Midwifery Policy Advisor for WHO European region, to come address the floor. Thanks, Margrieta.
Thank you, Mervi, and I couldn't have said it better. Thank you for greeting our nurses and midwives who are joining us today for European Nursing Week on this standing webinar that we have together with EFNNMA, EFN, and ENSA. We're really pleased to see you all, and we're really pleased to always see the numbers that turn up for this webinar. I'm going to just maybe jump into my presentation, and then unusually I have a little bit more time today to speak to you because we are also expecting next week the second State of the World's Nursing report. The following year, we hope to see the State of the Midwifery report, but next week is very important for seeing the State of the World's Nursing report, the second of its kind. And today I want to show you a little bit about how we're thinking in the European Regional Office here in Copenhagen. So I'm going to share my slides. I think it's safe to say that at the WHO Regional Office for Europe, we're really changing the tide on retention and recruitment of nurses, particularly with the work of the nursing action that we are here in Brussels with our colleagues from ENSA, EFNNMA, and EFN to work on this week. And for those of you who are from outside of the region, just a reminder that the European region serves 53 countries, not just the EU, and that we are only one of the 6 regions that support our colleagues at headquarters. But despite, all of these countries, all of these languages, all of these time zones, we do, in the European region, face a lot of common challenges. And this year, not only are we launching the second State of the World's Nursing Report, but in the European region, we launched the European Health Report. Actually, we launched it just at the end of last year. And I wanted to highlight some of the health issues that we're facing so that we can also then talk a little bit about some of the new information that we have about the nursing workforce and contextualize that. So the first point is that our population is aging in the European region. And for the first time, the population exceeding 65 years of age is larger than the population under 15 years of age. And that's not a problem in itself, obviously. But the problem really is that a third of the people aged 85 and over have long-term care and support needs. And only 50%, or nearly 50% of older people with severe self-care difficulties do not actually get the help that they need. We also have an issue in the childhood stages. We are seeing that some of the basic procurements of health promotion and supporting our families to reach the first milestones in the first 5 years of life are not being reached. 76,000 children in our region die before the 5th birthday, and there is a 21-fold difference between our member states in terms of child mortality. This is unacceptable. We're also seeing that amongst our adolescents, we're struggling with the increased use of e-cigarettes. So for a time, we saw some decrease in the use of cigarettes, but now we're seeing the increased use of e-cigarettes. And our mental health crisis is growing. We are seeing that girls' mental health well-being is generally worse than boys, with 1 in 4 women and girls experiencing violence in their lifetime. But men are 4 times more affected than women when it comes to suicide. And it is a leading cause of death amongst our young people. We're also seeing a resurgence of vaccine-preventable diseases, something that nurses have a very important role in, and midwives have a very important role in mitigating and changing the tide on. So we've seen an increase in measles cases and the cases of pertussis, but we're also seeing, most importantly, gaps in vaccination coverage. So we are not meeting the target coverage of 95% on any of these top 3 vaccines. The diphtheria, tetanus, pertussis vaccine, we're not reaching, we're just barely reaching 95% for the 3rd dose. And measles-containing vaccine, 2nd dose, we're only reaching 91%. Unfortunately, we also have the antimicrobial resistance challenge in our region, and we're just as we are globally, and 1 death in every 20 seconds is attributed to AMR resistance, or at least that will be the reality by 2015 at the course that we are taking. We're also very concerned about tobacco use. I mentioned 25.3% of people in the region are tobacco users, and our region has the highest alcohol intake, with 8.8 liters of pure alcohol per adult per year in the European region. Now, obesity is also a major problem in our region, with 25% of the European region's adults affected. So the issues are not about not knowing what is good for us, not knowing what to treat or diagnose, or even what to do, but it's that quality of care that we're missing. And nurses, and particularly I'm talking about nurses here, but nurses and midwives improve access to quality and timeliness of care. I want to emphasize this framing of our understanding of what we really add to the system to improve those health outcomes. We personalize care, we expand care by increasing opportunities for prevention, we connect care, we connect them to the right health workers, but also to the right sectors that need to be connected for our communities. And we secure cares. We accompany our patients and our communities to ensure that they are understanding what they need to do and that we are supporting them with the gaps that they are facing. Here's just some statistics and some points about the burden of unsafe care when we don't have well-supported nurses and midwives to support the quality of care. We see that the occurrence of adverse events due to unsafe care is one of the 10 leading causes, with 1 in every 10 patients harmed while receiving hospital care, and as many as 4 in 10 patients are harmed in primary and outpatient health care. The direct cost of treating patients who have been harmed during their care approaches 13% of health spending. Those costs are increasing because we have harmed them, or we have missed care, or we have delayed care. And this is in our scope as nurses and midwives. We're excluding safety lapses that may not be preventable, puts this figure at 8.7% of health expenditure. And the social cost can be valued at $1 to $2 trillion a year. So eliminating patient harm could boost global economic growth by over 0.7% a year. So we nurses are not just in employment in us as a profession, who we represent, but we are an investment in the economy. So what is happening with that nursing workforce? I can't really tell you all the details because the launch is on May 12th. But here is a QR code to register for that launch of the second State of the World's Nursing Report. But what I can share with you is some of the information that we do have at our disposal currently to share with you. We have seen, in terms of education, an increase by 2% of the number of nursing graduates. However, we've seen a decrease in the proportion of 15-year-olds who are interested in becoming a nurse. And we are facing competition with the IT professions. They are finding it, young people at the age of 15 are looking more towards IT professions than at health professions. We are seeing an increase. We have seen an increase by 8% of the density of nurses, but this has to be taken into consideration with other available health workers. And we have a very diverse picture in our region, with some countries facing very low numbers of nurses, but high numbers of doctors, or high number of nurses, but low numbers of doctors. And so these, and this doesn't even reflect the physiotherapists, the rehabilitation therapists, the midwives, the social workers that we have at our disposal. So we cannot see these increases in densities alone, but rather in terms of how they are configured with a wider skill mix. We also know that most of our nurses are women. And, you know, that again is not a problem in itself, except that we do live in an unequal society where a lot of burden of care, burden of responsibility is on women. And that changes their ability to work, to progress, to engage with their career in meaningful ways that we need them to engage with. But it also limits the access to all these men that could be part of our workforce. And it reflects a feminization of care work. It reflects a misunderstanding that this is just women's work and that it takes away that responsibility from our men. We have an aging workforce, and it's much more acute in our region with our doctors, but we do see in our nursing workforce some countries facing over 30% of their nurses above 50 years of age. And so that, you know, 2% growth is not going to replace those people who are soon going to retire. Or we have some parts of our region that are facing a very young workforce. And that's really important to ensure quality of care as well, to make sure that there are older health workers around them that have the opportunities to transfer their knowledge to these nurses. We see in some of our region a very high reliance on foreign trained nurses, which reflects the need for those countries to really invest in their local workforce. What is happening that their local workforce or their local women and men are not entering this workforce? Some positive news, and I will give you a teaser to say there's some good news on advancing roles for nurses in the State of the World's Nursing Report. But I'm not going to talk too much about that, only just to say that we at the WHO region have supported our member states' understanding of how you can support implementing advanced practice from a systemic way, really ensuring not just that you have these nurses working in advanced roles, but that the education, the regulation, the research, the leadership, and the financing is backing those advanced roles so that they really take hold in their systems, that they really support improved health outcomes. We also have good news in leadership in our region, and we will stand out in this report for the work we've been doing with our government chief nursing officers that we've been convening very actively, very carefully, and they have also been engaged in the nursing action. We've seen an increase in government chief nursing officers who are linked with increased regulation of education and working conditions. In our region, we've seen a rise from 66% to 75%. And we've unpacked for our colleagues in other regions those different models and the different advantages of those different models of government chief nursing officers and how they can help support the workforce and improved health outcomes. And you can go to our technical brief. There's a QR code about this that really shows how our government chief nursing officers are also really involved in improving the capability and capacity of our nurses. They're really involved in planning strategic directions for the workforce, becoming liaisons with other health professionals and other sectors, but also ensuring appropriate partnerships with different sectors and academic institutions. We do, however, need to support these government chief roles, and we have a very clear sense of what they need more to do their work more effectively. They need a mandate. They need access to informed decision-making where they do not. They need support and financial resources, and we need to engage their contributions, not only listen to them, but act on their contributions. And they too need their own sets of competencies and training opportunities that are very different from some other roles that nurses have, especially because of the gender equality gap. Not only do we see the largest gender pay gap in the health sector, but we see it in the leadership positions. Despite the nursing and midwifery workforces being upwards from 89% women, we only see 30% of leadership positions in health assumed by women. So we have shortages. We have some challenges with attracting health workers. I've mentioned a few, but we've also unfortunately seen some deaths related to COVID. We've seen the migration. We've seen increase in part-time jobs and an increased resignation. But to exacerbate this shortage, we have growing health needs. On May 12th, we'll launch the second State of the World's Nursing Report. The week of May 21st, we're going to have a side event on the Global Strategic Directions on Nursing and Midwifery, led by our Romanian Ministry of Health. That is going to be during the World Health Assembly, where we're going to take that second State of the World's Nursing Report and hopefully unite all member states from all over the world to introduce a second stage to the Global Strategic Directions on Nursing and Midwifery, which have been so very important in steering our work and our focus on supporting this workforce in terms of jobs, service delivery, education, and leadership. But in the European region, we also have the Bucharest Declaration and the Framework for Action on Investing and Supporting Our Health and Care Workforce, where at the center of it is the retention and the recruitment of this workforce. Not recruitment first, but retention. Let's make this workforce and let's make the health and care workforce a meaningful place to work so that when we recruit and I've been in discussions this week about the innovative ideas that our European Nursing Student Association has for attracting more nurses into nursing. But if we don't create an environment in which they'll be retained, we're going to be at a loss. So this framework for action puts that at the core of our strategies. I want to say a last point, and I'm wrapping up now, but basically, all of this sort of progress in our European region has put us in a very good position to work with the European Commission on what we call the nursing action. And we hope that that work will have a trickle effect to our other member states, and we'll be able to carry that intelligence and that capacity amongst our nursing stakeholders to improve retention and recruitment. We have 19 participating countries. And this nursing action is key for introducing new retention and recruitment policies, build on the existing resolutions and directions that we've already discussed, really strengthening the capacity of our government chief nursing officers and our workforce officers, but also strengthening and working closely with our associations, our unions, and our regulators, our students, and making sure that we're a fit-for-purpose, future-relevant workforce. I am so pleased about this nursing action. It is working closely with EFNNMA, EFN, ENSA, EPSU, and DG Santé, and I'm happy to say that we're adding the HOSPEAM network, which is the health service network, health service and employers network in the EU. I'm going to wrap up, but what I wanted to show was that in terms of the recruitment policies, we're going to feed these recruitment policies, these discussions with all of our stakeholders at the national level and at the European level with information about education market analyses, what's happening in the education sector in these countries, what's happening with mentorship capacity and experiences. And our retention strategies are going to be informed by really in-depth quality of employment analysis, assessments of nurse and well-being, and mental health, which many of you will have participated in that survey, the staffing capacities in these countries, the safe staffing capacities, thanks to the work of EFN, and digital health tools to support working conditions. This was the survey. We've closed it already. We're working to analyze it towards these improvements. So with that and with no further ado, I wish us all moving forward better care, more equity amongst our workforce, and ultimately resilience and recovery. Thank you.
That's great. Thank you, both Mervi for opening and also Maggie in terms of setting the scene in terms of the taking stock of the key issues. And I suppose important just to emphasize the launch of the State of the World Nursing Report next Monday, and also the importance in terms of the Nursing Action project as well. I just want to make one or two announcements. Just a reminder that we do have two channels. One is in Russian and one is in English. If you're looking for the Russian interpreter channel, and if it's not at the bottom of your screen, it can be found in the ellipse, which is the three dots at the bottom of your screen. If you have any questions, please put them into the QA button, and if we have time, we will come to those questions. And I just wanted also just to highlight that we are using Slido. You'll see a message will come up on your screen, and we'll be asking different questions just to gauge some views from across Europe and across the world, because I know that we have people joining us from Africa and also Asia as well. So I'm not going to talk any longer. I want to move straight on to our speakers. We have three speakers, and then we have a panel discussion. So our next speaker is from the European Federation of Nurses. It's Manuel Balotta, who's going to talk about the importance of safe staffing for the well-being of nurses. And Manuel is the policy officer for EFN. So I'll hand over to Manuel.
Hi, everyone. Thank you for, I'm really happy to be here. I'm now going to share my screen, my slides. Just give me a moment. There you go. I hope you can see this. Okay, sorry about that. Okay, I hope you can see me well.
Yeah, we can. Thank you, Manuel.
So I'm very glad to be here. It's an honor to be here and to speak after Maggie, who gave such a great presentation and introduced the context so well. So EFN is the European Federation of Nurses Associations. We have 36 members, National Nurses Association from 35 EU and European countries. We represent 3 million nurses in the EU and 6 million nurses in the broader European region. We work in Brussels closely with the European Commission, the Council of the EU, and the European Parliament to advance the nursing profession in the European Union. We have 3 key priorities, which are very much linked to safe staffing and to safe staffing levels. Of course, the first one is education. This is very important because safe staffing is not a question just of the number of nurses, but it is also a question of having enough highly educated and trained nurses in line with the Professional Qualifications Directive that sets the minimum education standards in the EU. It is also a question of workforce. Of course, it is a question of tackling and ensuring that we have enough nurses. It is a question of tackling the shortages in order to have the nursing workforce needed to have safe staffing. And it is a question also, of course, of patient safety and quality of care, because as there is a lot of international evidence already for many years that demonstrates the link between safe staffing and with the link between safe staffing and patients' outcomes. In fact, there's a lot of research from Linda Eichen or from Griffiths that demonstrate that if we do not have enough nurses on the ward, this will lead to higher mortality rate and negative patient outcomes. On the other hand, having safe staffing will lead to greater job satisfaction and therefore greater nursing retention, as Maggie already said. Now, although there is no universally accepted standard for safe staffing levels, with optimal levels that depend from many factors, from the patient acuity, from the care environment, there has been a growing momentum internationally towards developing and implementing safe staffing levels at the legislative level, as we have seen in several US federal states, for example, California, but also as we've seen in Australia, what this has shown is that indeed you can implement safe staffing levels and this can lead to very much positive results. As Europe is still lagging behind on this, and of course to support its advocacy efforts, EFN has conducted a first study in 2023, which was followed by a study in 2025 in the context of the nursing action, which is coordinated by Maggie's team and which is funded by the European Commission. So first, in 2023, our study was focused on the availability of national legislation in relation to safe nurse staffing levels, the reasons for not having established safe nursing staffing levels, methods for determining safe nursing staffing level and skill mix, and whether there are agreements for nurses' accountability in cases when minimum safe nursing staffing levels are met. So overall, what these results had shown is that from examining the nurse-patient duration legislation across 35 EFN members countries, what it revealed that there was a lack of comprehensive mandatory nurse-patient duration laws. And those some countries had taken some steps toward legislating safe nursing staffing levels. A deeper analysis showed that there was a limitation in scope and enforceability. And there were also limitations in terms of the available methodology to determine safe staffing levels. Now, in 2025, in the context of the nursing action, we have taken these questions and we have expanded them to look into more depth. Of course, we looked again at the availability of legislation and availability of methodology, but also the type of tools that are available to help determine safe staffing levels, the role of the NNAs, the EFN members, in setting safe staffing levels at the national level, the presence or absence of training available for nurses to help them implement safe staffing levels, establish processes for reporting when safe staffing levels are not met, and then again, the question of liability, whether the nurses are held accountable in cases when negative patient outcomes are the results of the absence of safe staffing levels, and whether then the liability is on the employer. So just for some preliminary results, what we saw is that there is indeed a movement towards setting safe staffing levels, and its importance is recognized around the European region more, with several countries that have worked towards the implementation of some type of framework relating to safe staffing. Several countries have an established methodology to determine safe staffing levels and skill mix, which is in most cases approved by the government. And it is also it also revealed that the EFN members are playing a very important role in collaboration with their ministers of health in setting safe staffing levels and legislation and other frameworks related to safe staffing at the national level through multifaceted involvement. So here we have some examples of what is being done in different countries. I will not go into each one of them, but what this shows is that indeed different countries are implementing some kind of framework related to safe staffing at different levels, tackling different healthcare settings. Some are more comprehensive than others. Some are mandatory, others are recommendation. But there is a movement towards this, and this is very clear. Here are more examples. So in some cases, this is set in the collective agreements. In some places, the responsibility of the employer is clearly set by law in order to protect the nurses. In some cases, the work is in progress, but this shows indeed that there is a positive movement and that we can work and we can build on what's already there to expand it and to make sure that this can be implemented across the EU and Europe. But of course, there are still several challenges. Despite there are legal frameworks related to safe staffing, it is also clear that these are often, even though they're of a mandatory nature, there is often a lack of implementation. And this is especially the case due to limited resources and especially the nursing shortages. So even if there are standards which are set, or at least on the minimum staffing ratios, it is clear that because of the shortages, often this cannot be fulfilled. There is also great variation seen among the methodologies. These different very much on the models on which they're based. There is very little training available for nurses to help them determine safe staffing levels. And then again, a big issue remains that in most of the cases, nurses are still liable in case adverse patient outcomes are the result of safe staffing levels not being met. And this is something that we need to work on, and that hopefully also in the context of the nursing action we can work towards to change, because this is extremely important to protect the well-being of our nurses. EFN, thanks to this collected data, has developed an implementation roadmap to guide the EU into developing and implementing safe staffing levels. And first, of course, we need to increase the awareness among many different working groups that are working on this topic. We need to make sure that these working groups include the nursing perspective by engaging with nursing stakeholders at the national and European level. Then, of course, this work should build towards the development of legislation on safe staffing at the EU level, which can help harmonize the existing legislation at the national level. Of course, this also requires more EU funding through the development of a healthcare workforce capacity fund. And of course, it should also determine formal protection mechanisms in cases of understaffed environments, which should address these vulnerabilities. On the long term, it should lead to the full integration and continuous improvement of safe staffing systems, which, of course, as I said at the beginning, there is not one catch-all solution. Of course, the implementation and development will have to depend from country to country, taking into case the national context, and they will need to be constantly evaluated throughout the year and throughout the years. But of course, this framework should allow for the implementation in a comprehensive implementation in all healthcare settings, including the community and the primary care, not just at the hospital level, and the work of all the stakeholders at the European level will continue to be crucial to ensure that we can achieve this. So thank you, and thank you for listening.
That's great. Thank you, Manuel. And I think one of the key things that I took out from your presentation was that safe staffing isn't just something that we campaign on and has no connection in terms of patient outcomes. And I think it's important to underline that the intrinsic link between morbidity and mortality in terms of patients, this research goes back nearly 30 years. And importantly, the impact that it has in the retention of nurses and midwives. And we can see that in one of the questions that we posed as part of the Slido, which was current wellbeing challenges facing nurse and midwives. And the biggest one is burnout. So, and it's supported by workplace atmosphere in terms of violence in the workplace, you know, lack of nurses and so forth as well. I know from an Irish perspective, it is the number one issue that most things are connected to. I don't see any questions in the Q&A. Just a reminder that we do have the Slido going, and we've posed a Slido question and also a Zoom question as well. So we've posed the question: the current staffing levels in my workplace are sufficient to ensure safe and high quality patient care. So answer that, tell us how things are currently in your workplace, in your health system, and we will come back to those results as we move on. Keep an eye on the Slido because there will be other information. So I don't have any questions, but we might come back to some questions as they appear. So thank you, Manuel. I'm going to move on to our next speakers, because there are 4 speakers from the European Nursing Students Association, shaped Monadni-Dolled, Valentin, Vallé, Tikva, Koronnman, and Tim Mitnik. And they're going to talk about hand-in-hand mentorship as a key for the well-being of nursing students. So I'll hand over to Shaped, I think, is probably going to start off.
Thank you, Steve. I will start.
Oh, Tim's going to start off, yeah.
I will share the presentation. Can you see it?
Yes, we can see it.
So I want to start that we have a small change of speakers because Valentin, our nursing policy coordinator, needed to go to a shift because of lack of human resources as usual. So, but we have much wanted person with us. It's the president of ENMW. Is Francisco Ferraz from Portugal, and he wanted to start this presentation with sharing some greetings for the Nursing Week. We cannot hear you, Francisco. No.
Can you hear me now?
Yes.
Maybe that's better. Okay. So, dear colleagues, esteemed students, distinguished nursing and midwifery professionals, on behalf of the European Nursing Students Association, it is with great honor and deep gratitude that I address you today on this very special occasion, the celebration of the Nursing and Midwifery Week. Before giving the words to my colleagues in ENMW, and on behalf of our association, I want to share with you our vision in regards to mentorship and the vision we have already given in the project of the Nursing Action, and the vision that we will continue to follow for the future in this project. This week is, above all, a time to recognize and celebrate the dedication, compassion, and excellence of those who care for human life during its most fragile and transformative moments. It is also an opportunity to reflect on the future of our professionals, the students, and how we can build an even more prepared, resilient, and innovative generation. On this path of growth and evolution, mentorship plays an absolutely vital role. Mentorship is more than the transmission of technical knowledge. It is an act of generosity and commitment, where the experience of some guides the enthusiasm and the potential of others. It is a meeting of generations that transforms knowledge into wisdom. For nursing and midwifery students, having a mentor means having someone who believes in their talents, who offers guidance through doubts, who inspire during difficulties, and who challenges them to go further. A mentor does not simply teach procedures. A mentor teaches humanity, ethics, leadership, and how to be a true force for positive change in the lives of those we care for. In this context, I want to leave a word of encouragement to all the students that are here. To seek your mentors, listen to them, question them, and be inspired by them. And one day, become mentors yourselves for those who will follow. And that is how the greatness of our profession is built. To all nurses and midwives, we offer our most sincere gratitude for the example that you set. May this Nursing and Midwifery Week be not only the celebration, but also a renewal of our commitment to excellence in care and in supporting the growth of the future generations. Together with the strength of our history and the hope for our future, we will continue to transform the lives. Thank you very much, and I wish you all a wonderful Nursing and Midwifery Week. Over to you, Tim. Thank you.
Thank you, Francisco, for these words, and from us also, from the entire NC team, as Francisco said, happy Nursing and Midwifery Week. So let's go to our presentation. I have the honor to have with me two ENMW members and two members of the European Affairs team. Is Shaked, our research officer, and Tikva, our education officer. As you've seen the title of our presentation, ending mentorship as a key for well-being of nursing students, you probably think to yourself, it's not new, it's nothing new, mentorship, but Maggie and Manuel already said that ENMW is a part of the nursing action. And we dealt with this mentoring issue from a new perspective, because there was a lot of research, a lot of project about mentorship, but the voice of the students was not heard and was not taken in consideration. So what's interesting that we found how much mentorship is related to the well-being of nursing students. And that's what we want to bring you today, the voices of nursing students from across Europe and what they say about mentorship. So we will start with, one moment, we will start with a voice from Greece. Knowing my mentor, Anna, believed in me during that tough placement made all the difference. It wasn't just about skills, it was feeling like I belonged and could actually do this. Now to you, Shaked, our research officer.
Thank you, Tim. So, as we kept hearing during our interviews with the students, it was more about than the academic success. It was about being seen. Most of the students kept talking about how powerful it is for them to be seen by their peers and by the nurses in the world. So as we all know, the ICN published a report 2 weeks ago about burnout, and we can see the increase in burnout among nurses. So there's a real staffing challenge, as we talked about earlier. And due to that challenge, students often feel isolated, underappreciated. They feel like they're not receiving the most out of their placement. And one of the biggest flaws that we found is that sometimes nurses that just finish nursing school are expected to take the mentorship role, and they need a mentor for themselves on their own. So it can be tough on both sides, and it can affect the student's experience during their clinical placement. So what did students across Europe say that they needed? They said that they needed emotional support, and it's not from a place of weakness or for being soft. It's just because they want to be empowered. They need confidence boosters. They need a real role model that they can relate to and want to aspire to be like in the future. And they want a connection to the purpose, which is why we all chose this profession. We chose it for the purpose. And we need someone to connect us to this purpose. One of the students said that it changed how she saw herself as a future nurse. I think it's a very impactful and powerful thing to hear from students, the change that you can make for us, the future nurses that you can shape us to be. So, yeah, it's very, very important.
And thank you, Shaked. We will continue now with Tikva, our education officer.
Thank you. Let's take a moment to reflect. I invite you all also to write in the chat which mentor, which kind of mentor would you personally want? Is it someone like type A, who's technically brilliant but unavailable? Is it somebody like B, always present and empathetic? Is it somebody like C, who's balanced but unsure of role? We found, if you can see, I suppose, you'll see that most people would prefer sorry, most people would prefer a mentor that has all three in one, all three types. And that's something that's supported, that's something that we see that most students agree on, and that's something that a mentor, sorry, sorry. Anyway, sorry, I'm on the wrong, sorry. One student said that my mentor was too busy. I stopped asking for help. We noticed that students need a mentor that has time and who's available, and not just somebody who's brilliant, but somebody who is available and can listen to them. And that's why we found that the power of peers. If I ask you a question, have you ever learned more from peer than from professor? I'm sure for many students, the answer is yes. That's what we found out. Peer mentors often provide relatable insights and create a comfortable learning environment. especially when faculty and are occupied, as I said before, with a number of responsibilities. Peer support become an invaluable resource. So peer mentorship fosters a sense of community and can significantly enhance the educational experience. Sorry. Now the right slide is before. The one before, yeah. So we strongly we see that stronger together. We found out that students consistently describe peer mentoring as less intimidating than faculty mentorship, a source of both emotional and academic support, a means to build community and reduce feelings of isolation. So therefore, we saw that students would appreciate mentorship from peers. I give it back to Shaked.
Thank you. So another voice we heard from the students was that connecting with someone who just went through the same course that we do gave them confidence and clarity. And it's something to keep in mind. We have a few research suggestions for the future. First of all is that peer mentorship improves retention and academic preparedness. The second is that it's enhancing the satisfaction and self-efficacy during the clinical training. And the third one is that perhaps students can become the future mentors themselves. It's something to keep in mind, and I would like you all to consider what your institution can do to grow the peer mentorship and make it more substantial. Thank you. Jean?
Yes, and the last voice that we want you to hear from Europe, and so you will understand how much mentorship is important for students. A student told us she didn't teach with words, she taught with presence. A good mentor that standing next to a student could change the world for students and could bring them more safely and more happily to their work as a nurse. I hope you get a small sense of how important mentoring is for students, and not just for being a better clinician, better profession, but being a better human. And we in ENMW, we truly believe that a good mentor is also the key for the well-being of the nursing student across Europe. Again, thank you very much for listening to us, and we wish you good midwifery and nursing week. Thank you.
That's great. Thank you very much from the team from ENSA in terms of their presentations in relation to the role of mentorship in supporting student nurses and midwives as well. It's absolutely crucial, as we have a shortage of midwives and nurses, that we support them through the education process, and even beyond that, as early career nurses, the importance of actually providing that support for a period after qualification, or people join the registers within their particular country. There's no questions on the Q&A, so just a reminder to put some questions into the Q&A. And I've also seen a number of people are interacting in relationship to the question on Menti, which is the current challenges in education facing nurses and midwives. And the comments that are coming up is a shortage of clinical placement places because of increased numbers of graduates that are required in countries to overcome the shortage, and the bridging the gap, which is the classic problem in terms of linking what is taught theoretically and what is actually practiced in the real world. Also, the financial challenges faced by students, and there are various different approaches for supporting students across Europe, including bursaries, including apprenticeship type models. But quite often students are faced with shouldering that burden on their own. And other people have said that it can be quite isolating. And also the challenges around the rapid change are in relation to e-health and the introduction of digital technology, both in education, but also in clinical practice and health systems as well. Somebody's put professional attitudes. I'm not quite sure what that means, but in terms of more detail, but I know it is important in terms of when we have students coming through the system, that we do see them as the next generation of nurses, and that we have a duty, a professional responsibility to ensure that we support and nurture those students. No questions have come up, so I just got one question, which relates to around support. An issue that's come up for us in Ireland is around the importance of providing what we term as pastoral care. And I've seen this come up in the presentations that were made. It's around isolation, it's around emotional support. I'm just wondering, Tim, or perhaps any of the other presenters, that issue around pastoral support, how important that is.
Excuse me, we didn't hear you acoustically.
It's around pastoral support, so it relates to the emotional support. It relates to issues around building confidence. It relates to just dealing with the stress and anxiety that students face. How important is that, providing that pastoral support?
Yes, thank you for the question. We wanted to say that ENMW is also involved in a project with the European Student Union and the European Medical Student Association about the access of healthcare students to mental health support, like institutional. It's an issue across Europe because a lot of time universities don't have this capacity to help students with well-being and like with psychological and trauma. And sometimes they need to go to the public sector, to the health provider to find the support. But as we probably know, a lot of systems don't have the capacity or the ability to deal with it quickly. And sometimes they don't understand also the difficulties of the nursing and the healthcare students problem. That's why we are working in this European project to find solution to mental being support for healthcare students across Europe, so they will have access to it through universities, through projects, so it will be especially for them. We know it's a problem, and like this problem is already dealt on the European level with our partners. So it's something that needs to be changed, and students definitely need a lot of support from a lot of partners and in a lot of ways that only university cannot support, and only mentors cannot support if they're in a crisis. But thank you for the question.
That's great. Thank you, Tim, and for colleagues from ENSA on a crucially important issue in terms of retention of nurses, retention of students, and trying to reduce in terms of the loss of students on education programs. So thank you very much. I'm going to move on just because of the pressure of time to our next speakers. And they're going to talk on flourishing. So it's about from a positive psychology concept, and it's about well-being for nurses and midwives. And we have Mary Rose Sweeney and Katja Salalainen.
That's correct.
Yes, hopefully that's, apologies if I've mispronounced that, from the Royal College of Surgeons in Islands. So I'm going to hand over to Mary and Katya.
Thank you very much, Steve. Can everyone hear me okay?
Yes.
Yeah, great. Okay. So good afternoon, everyone. And thanks so much to Steve for the invitation to speak at this afternoon's event. We really appreciate it. My name is Mary Rose Sweeney, and I'm the Executive Vice Dean for Education in the Faculty of Nursing and Midwifery in the RCSI. And this afternoon, I'm sharing the presentation with Dr. Katya Savalon. And Steve, I have also trouble pronouncing that name, and I've been working with Katya for 6 months. So Katya is a lecturer working with me, and over the last 9 months, we've put together this program, which is really an evidence-based program to support nurses and midwives with well-being. So we'll explain a bit more what we mean about that in a second. So next slide, please, Katya. So just in case you don't know anything about us or the faculty, so we're in the Faculty of Nursing and Midwifery in the Royal College of Surgeons in Dublin. And our role there is to develop and accredit continuous professional development programs, which are often, bespoke programs for nurses, midwives, and wider health and social care professionals. And we develop and deliver these with input from national and international experts. So we find leading subject experts who are eating and drinking their topic area to work with us to put together programs. And our aim is to be innovative always, to be agile, so responding to issues as they emerge, to be flexible and to complement what the other universities are doing, because there's no point in us all doing the same stuff. So we're trying to operate in the spaces in between other universities, and we want to support nurses and midwives personally and professionally, because these things are often interlinked. And in the very changing and challenging health landscapes that exist currently, and I only joined the call a few minutes ago, but you've all alluded to these very challenging circumstances in which we're all working. Next slide, please. So I hear you asking, where do we get our ideas for these programs? So basically, they can come from multiple sources, and I probably haven't even listed all of them, but just to give you a sense of where we get some of the ideas. So obviously, we respond to evidence from scientific literature. We respond to asks from policy reports, such as from the WHO or the ICN State of the World Nursing, and from frameworks such as the SDG Sustainable Development Goals. We've been approached by national and international partnerships. We've been approached through professional networks, through even just individuals or organizations. And sometimes we respond to, funding calls or tenders. And then obviously personnel within the health system often approach us to say that they are struggling with things like burnout, attrition, or other specific clinical issues. So we put together any program that anybody asks, and they're basically all bespoke. And we develop, deliver, and accredit them. So it's not hard to understand how we came across the idea to develop a program on flourishing for nurses, because basically it's been alluded to and highlighted in the policy reports. It's been alluded to and highlighted in research papers. It's been alluded to and highlighted, in the media, mainstream media. Nurses themselves and basically everybody, particularly post-COVID, was talking about burnout and all of the challenging mental health and wellbeing issues emerging for nurses right across their career stages and midwives. So I'll just tell you a little bit how Flourishing came about. It started its life from, hello Slovenia, I just saw a message there. It started its life as Flourish, which was a program we developed for undergraduate students in Dublin City University, where I worked during the pandemic. Even before the pandemic, we realized that our student body were feeling very overwhelmed and finding it very hard to get their lives into some kind of balance. So this program actually started pre-COVID, but it became even more important during COVID. And so we built theoretical elements which linked health behaviors to mental well-being. And we had user-friendly tools so the students could very quickly see that tweaking their nutrition or their physical activity levels or their sleeping patterns or their use of technology, like, the doom scrolling that we all tend towards these days, like spending time in the outdoors, the importance of spending time with their friends and not cancelling their appointments because they were too busy, and even the arts. And they very quickly saw that small tweaks could improve their own well-being. And then the more robust measures like the student evaluation showed, yes, that students felt better who had taken the program. So that is how Flourishing came about. Next slide, please. So when I arrived here in the Royal College, this was one of the first things I wanted to do, was evolve the program Flourish, which was for undergraduate students, to Flourishing, which was a program specifically for nurses, midwives, and wider health and social care professionals. Because as you can appreciate, the issues for this cohort are somewhat different, although not entirely different to what the undergrad students would have needed. So targeting personal, professional, organizational, and even cultural factors that all come into play in the life of a healthcare professional, and to help them to understand actually what is the science behind well-being and what factors influence it positively and negatively. And we were conscious that nurses and midwives probably already know a lot of this, so a lot of it is reiterating them and reminding them what they need to do to improve their well-being. So all of the sessions are evidence-based, so really complex science being condensed into bite-sized pieces, maybe half an hour or 10 minutes of back and forth interviewing. So where I'm interviewing an expert, like in a chat show, and just trying to really pull out the most important nuggets of information. And we had contributions from psychologists, including positive psychologists, psychotherapists, nurses, midwives, dietitians, physiotherapists, digital scientists, and occupational health. And there's lots more in there as well. I'm just listing the main ones. And they span everything from making sure your diet is good. And just, as an example, diet is so important for well-being. There's quite a bit of science around the fact that there are physical and chemical connections from the gut to the brain in the form of the vagus nerve, and all of the neurons and all of the chemicals and serotonin being produced from protein. So it's distilling the evidence into bite-sized pieces. And the same that happened for sleep, for trauma, for green and blue spaces, for physical activity, and all the importance of those. Next slide, please. So I'm going to hand over to Katia, then, who's going to talk you through the actual 12-week program and what you need to do if you'd like to take the program. Thanks very much, Katia.
Thank you, Mary Rose. And I work with Mary Rose on this program. I hope you all can hear me. Just making sure you are, and you just have to let me know if you don't. Yeah. I mean, I'm repeating what we've been hearing in the whole webinar, and also what Mary Rose spoke about there about the well-being of nurses. But we wanted really to also incorporate this program in the evidence base that's coming through, both nationally here in Ireland, but internationally. And we know that compared to the general population, nurses and midwives are seeking help for stress and burnout at higher levels than the general populations. COVID-19 was one of those events that had an impact, not necessarily caused new problems, but also highlighted some of the existing problems that we do have when it comes to well-being of nurses. And also we have a tendency of continuing to work even as nurses and midwives, and whereas own well-being might not be our priority always, because we feel like we are letting our colleagues down if we don't attend a shift or we don't keep going. So all this kind of emerging research that's coming out is that nurses and midwives, unfortunately, are in a much higher risk of suicide, burnout, anxiety, and depression. And it's also at any level. So it's not just the most advanced nurses and midwives that are feeling it. They are felt already at the student level before they are becoming a registered nurse. So this is the key challenges we wanted to create a well-being program within, to understand that in order to provide a well-being program, we need to also understand that this is they need to have a flourishing healthcare profession where they be able to kind of use their own personal well-being in a way that makes them efficient and well nurses and midwives going forward. We've spoken about COVID-19. The demands of healthcare needs to acknowledge that well-being program that might work for an office worker that works Monday to Friday, 9 to 5. It might not be even practical for a nurse or midwife that are working shift work or in a situation where the demands are completely different. Not just demands from patients, but nowadays also demands from colleagues. The relationships that happens in the conflicts that happen in hospitals or in healthcare organizations, but then also the demands for family visitors and all the rest. And then, like mentioning, there is a risk then for this increased level of anxiety, burnout, which we need to acknowledge, and we cannot think that it doesn't exist. We need to acknowledge that risk, that higher risk than general population exists. So that's kind of the background to Flourishing. We kind of gone a lot about the background of Flourishing. So Flourishing is a well-being program that's delivered online, and it's asynchronous, which has no kind of assignments to it, but it has reflection parts, and it is, like Mary Rose said, an evidence-based tailored program. And I'll with the leading experts in the area of nursing midwifery or their area of research. So for instance, nutrition or physical activity, or if they are in the psychology area. And they provide that bite-sized information that Mary Rose spoke about. And we have great experts that provide also that information that is evidence-based, because what we're also competing with in the well-being space is that TikTok knowledge that not necessarily is embedded in scientific and evidence-based information. And hopefully the nurses that take on this program can see the benefit of understanding that for their patients and for their those that they care for. So there's 12 main topics, although we talk about things like nutrition and physical activity and sleep, which are very physical well-being aspects. There are elements such as trauma, burnout in the workplace, moral injury, professional relationships, and even inner critic and inner beliefs that might impact our role as a nurse or a midwife. I hope this video works and you can hear it well. You might have to turn up your volume a little bit, but it's a quick, very short snippet from assistant professor at Macaulay School of Nursing in the University of Detroit, Dr. Patrice Wade Olson, who brilliantly spoke with Mary Rose in this kind of chat show way about trauma and how it actually impacts us as nurses, and we need to be aware of that impact. So I hope it works. You hear a bit of music, I hope. Yeah.
No.
No, it's not working. Okay, sorry. Well, then you don't get to see a small short video. Sorry about that. It sometimes works and it doesn't work. I thought Zoom actually would probably be limiting the audio, but what she talks about is exactly that element of how trauma and trauma-informed care, how we need to be aware of our own responses to trauma in order to provide care. And it is those kind of concepts such as moral injury and trauma-introduced care that we need to be aware of as nurses and midwives, because I know as me training 20 years ago, we didn't talk about these, but they do impact your everyday in terms of providing your care. So just going back to the key components of the flourishing. So we talk about physical wellness, all right, but we talk about knowledge and well-being in the scope of that professional growth of being nurse and midwife, and also kind of linking the personal well-being with being a professional nurse in order to provide tools to be well. And one of the key things that was really important for us in Flourishing was to have a comprehensive evaluation, because well-being programs are only as good as their evaluation. So one of the key things we needed to do is to make sure that there is a pre and post-program evaluation to see the impact. But this also means that the program is also constantly evolving with what nurses and midwives want. So Flourishing today might not be the same as Flourishing in next year, because it might actually adapt to the needs of nurses and midwives working, and what would they like to know more about in their space of well-being as such. And we have also ethics for kind of focus groups, just to see what are the key things that we want to learn in a well-being program as such. I know I'm running out of time, but I'm at the conclusion here, Steve. So I just wanted to make sure to kind of say that when we talk about well-being of nurses and midwives, yes, there are multifaceted problems. There are systematic problems that sure enough needs to be addressed, but we also need to look at those individual tools of how can we encourage nurses and midwives to be well and maintain their own health in order to have a long and flourishing career as healthcare professionals. As we've heard, you know, there's high levels of burnout even at a very early stage of the career, but that means that we also need to prioritize the well-being of nurses and midwives going forward. This is one way of doing it, by incorporating it into CPD and acknowledging that these things are things that are going to affect our well-being as nurses and midwives. Just a couple of references. There's a QR code there at the end, but I'm also available on email. And the Flourishing is an active program if you're interested in it. So please do contact either myself or Professor Mary Rose Sweeney if wanted. That's it.
That's great. Thank you, Katja, and also Mary Rose for that presentation on Flourishing. A topic that's probably emerged in the last quarter of a century, as I mentioned, from the work of people like Martin Seligman from positive psychology movement. I was struck by, in terms you mentioned things such as the psychological pressures that nurses and midwives find themselves under, particularly in terms of their role in relationship to emotional labor, in terms of trying to carry that burden of, you know, experiencing some often awful things in terms of affecting individuals. Also, the importance in terms of health or anything such as gut health, the microbiome, gut microorganisms, changes in terms of the brain, plasticity of the brain. That's also an important component as well. You mentioned suicide, and I was struck recently by research that's being carried out in Sussex University by Ruth Riley, that's reporting that women nurses, that they're at a 23% higher risk of suicide, which is quite striking in terms of the pressures that nurses find themselves under. There's no questions. There is a question in there, but I'm going to leave that just for a while. But I have a question in relationship to the role of happiness, because that seems to be a big issue in terms of flourishing. I'm just wondering what part that might play in relationship to enabling people to flourish.
Oh, Mary Rose, you want to take it?
yeah, I can take it. I mean, I suppose we're trying to squeeze a lot in, so it probably comes up principally in the session on positive psychology, and it also comes up in just finding joy in whatever little thing appeals to you. So the session that's included is one on the speaker Rick Riccardi, how much he loves photography. But I mean, equally it could be going to the theatre or the opera or going for a run, or so it's about finding joy, even if it's only for 10 minutes, or if you love coffee and you only have 10 minutes, that's your little moment to find joy, because then that helps the brain and the biology in the brain to actually, light up. And there is a focus on that in the program. And as you know, well-being is so complex. So we could probably have part 2 where we touch on an awful lot more things. And I know that incivility in the workplace is something that is coming up as a very big topic in the last few months. And we are in talks with a really brilliant speaker who might add that session in as well. So as Kathy said, I think it will evolve all the time.
And there's great work being done in in Canada and America by Michael Leiter in terms of civility and respect in the workplace. So that issue of civility that he's explored, but that importance in terms of, I suppose, eudaimonia, which is that sort of looking for something that makes you happy, is important as well. But also recognizing that giving back to others as the most sustainable happiness as well. So I think that's important, and we should be the happiest professions, nursing and midwifery.
Yeah.
So thank you very much. Just to say the results that came in around flourishing, words or phrases that best describe your experience, things such as solid teamwork, continuing education, happiness, reflection, interpersonal connections, interprofessional collaboration. So that working with people and learning as well seemed to be what the audience was talking about. Okay, so thank you both to Katya and Mary Rose as well, and good luck with the program. Oh, just one question: is it available online to anybody? Is that?
Yes. Yeah, it's available online to anybody who wants it. Just contact either myself or Katya. We can get you set up, and it's completely self-paced. So, you can take it whatever time of the day or evening appeals to you, and it is quite succinct. So you're not going to be spending hours looking at materials or spending hours doing an assignment. So we took all that into consideration with how busy people are when we were designing it.
Okay, great. That's fantastic. And thank you very much. I'm just going to go back to the questions in the Q&A, which is how to tackle understaffing where nursing homes are not willing to hire foreign nationals, even if they are available for hire. I don't know if anyone wanted to come in, any of the panel, any of the speakers wanted to come in on that question.
Hey, I'm happy to. I think that's a very complicated question.
Yes.
For the audience. I don't think we tackle it with one solution, right? Is the main point here. It's very important that when foreign nationals come to our countries looking for work, that they're matched with the skills that they've invested their lives developing in their home countries, and that they're safe doing so. Yeah, we've had a very interesting discussion about staffing levels and how that can negatively affect understaffing in some places. If you place a far too low staffing level somewhere and in another facility there's a higher need or the patient load is more complex. So I think there's all sorts of solutions here. There's those flexible staffing levels. There's making sure that those staffing levels that we do bring in to facilities are needs focused, both for and we've been talking here in Brussels about just how much we need to take into consideration the skill mix within the nursing workforce. Do we have young or old, experienced or not experienced staffs? That has to be taken into consideration. And then also the complexity of your patients. So I think staffing levels is one way of dealing with it. Another is perhaps to understand the sorts of supports that are around for the foreign nationals to bring their skills up to par, or at least to be in line with the needs. There's a lot of it. Yeah, I'm going to give a few ideas, but I think that there are a lot more from this group of people that they can provide. And Steve, I know you've sort of looked at this too with your organization.
And it's interesting in Ireland that that's not the case that's being described, because internationally educated nurses are widely employed within the nursing home sector. And I would say that there's actually a large percentage of the nurses employed in that sector are internationally educated nurses. And one of the dangers actually that we see is that that they are potentially a vulnerable workforce. You know, there's issues around differences in pay, working conditions, the role of visas, particularly if they're tied to employers, pension entitlements, sick pay, professional development. So all of those are actually the issues that we face in terms of nurses employed, particularly in the private sector, where we're seeing a huge growth. 80% of nursing homes are now owned privately, and they're owned by groups as well, as opposed to individual providers. So we have a slightly different situation within Ireland. There's almost a willingness to employ foreign nationals, internationally educated nurses. Okay, so I'm going to move on just again, because of time pressure, I'm going to move on to the panel discussion. And just to welcome the panel members, we have Jose Cobos Serrano, who's the Vice President of the Spanish Nurses Association and also ICN board member. We have Yana Kabania, Chief Nurse from Russia. So just to highlight that when Yana is speaking, you can use the interpretation button. And if you can't see it, it's in the ellipse, the three buttons. We also have Aisling Culhane, who's the president of the Psychiatric Nurses Association, Horatio. And we also have Mervi Jokinen. So I'm going to welcome Mervi back as well. So I'm just going to start off with a question. And this is a question for all of the panelists, just in relationship to, because the theme is around directions for the future. In the context of well-being, and just to try to understand within your organization or within your health system the extent of the issue, what are the key issues for well-being, and perhaps an example in terms of what is happening to improve the situation in terms of well-being of nurses and midwives. So I'm going to go straight to Jose, just to start off.
Thank you, Steve. Thank you so much for inviting me. This is a very good opportunity to share our opinions and the situation around the European countries. In my opinion and my point of view, I think it's very important. One topic is the empowerment of the nurses, the empowerment of the organization to improve the new vision in the health system. Because I understand it's very important to moving the vision in the health system from healing to caring. So it's very important because now the society, the population, the citizens in the countries, we have chronic diseases or polymedication. A lot of things are changing in the focus of our activities in the health system. What is the pillar in my vision? The pillar is nurses of course, midwiferys, because we are focused in caring. It's not only to have medicine, it's very important. Prevention is very important, the social care. This is the reason because I think it's very important the governments and the health system provide more influence from the nurses. So I think the leadership from the nurses and midwifery is very important to influence in the health systems.
That's great. Thank you, Jose. Can I ask you in terms of one of the things we often see within nurses is the emphasis. In Ireland, we often see terms such as patient first. I'm just wondering what impact that might have on nurses who might consider themselves secondary in terms of their own welfare. Is that an issue that you've seen in your work internationally or in Spain?
Sorry, I can't hear.
I'm just wondering in terms of, we often hear the phrase sort of patient first being used. And that to me I often think to myself, well, if patients are first, who are second? And does that mean that nurses and midwives' welfare is secondary? Is that an issue that you've heard in your work internationally or in Spain?
Yeah, I think in terms of, I think it's very important, for example, introduce the competencies area to improve this idea. For example, if we talk about the nursing prescribing, no? What is the focus from the patient and from other professionals? Because sometimes here in Spain now we have a lot of discussion about the safety of the patient. So I think we need some changes into our profession to improve and influence in the patient vision and the politic vision and the other professional vision. That is crucial, I think, for the future.
Okay, great. Thank you, Jose. I'm going to move on to Jana next. So it's just a reminder in terms of going to the interpretation icon. So welcome, Jana.
Здравствуйте, уважаемые коллеги. Я присоединяюсь ко всем поздравлениям.
I'm happy to join all the greetings with the European Week of Nursing and Midwifery and share our best wishes to you for these great days when we can celebrate our professions, our colleagues, and reflect the global impact on health of our population and support of health of our population.
Вопрос.
Go ahead.
Уважаемые коллеги, ну, наверное, раз вопрос, наверное, один и тот же.
The question is the same towards all panelists, so I will try to share my opinion on this topic. First of all, it seems to me we should not forget about the soul of our profession, about the values of our profession. Nursing and midwifery was always about care, attention towards people who are close to you. So working in nursing, practicing nursing is impossible without your internal will to help and support people in their very difficult situations. And it's probably the main internal motivation to every nurse all around the globe. Of course, I'm very thankful to all colleagues who raise issues of emotional burnout, and probably reduction of professional achievements is the case when we ourselves do not understand what the role we play in providing care. What about the development for the future? I think it's very important, additionally to developing quality care and everything, it's prevention. It is important, and the key role of nurses is to work with population, to teach our patients to be healthy, to stay healthy. We are responsible not only for treating diseases, but for saving health. And the role of nurses in patient teaching is most valuable. And this is the point of growth for our profession and for increased value towards health systems. So our campaigns, our regular patient teaching work is very important. About retention, I think retention of workforce, I think it's a very important challenge for any country or the region, and one of the national projects in Russian Federation is devoted towards support of health personnel. Only complex measures could work well, and this should be reflected in social support towards nurses and midwives. It should include, as a practicing chief nurse, I think it's important, as a chief nurse of quite large surgical institution, it's important to have support from the leader. So staff nurses should be supported by their leaders. Mentorship should be improved and developed to allow young nurses to feel support, to feel safe, to feel aware in their actions and in their future. Great role belongs to professional organizations and professional associations that are to talk and to bring up discussions of the great importance to our professional society, and they also respond to these issues. So the key to success in retention is between close collaboration of all interested parties, medical organizations, governmental associations, educational institutions, and so on. Only by being united and focused on the system, supportive nurses and midwives, and focused on their well-being is very important. Thank you very much.
That's great. Thank you, Jana, for updating us in relationship to Russia and the importance of providing what you call social support, leadership and mentorship in supporting nurses in terms of their role, and working collaboratively with other key stakeholders in terms of trying to deal with the issue of retention. I'm just wondering, issues such as you mentioned, emotional burnout, professional achievement. I'm just wondering, to what levels have you noticed within Russia in terms of those issues around emotional burnout and a drop in professional achievement?
Unfortunately, I don't have any scientific evidence on the data, so I don't have some specific numbers on the level of emotional burnout, but I'm sure that a large proportion of nurses and midwives suffer from it. And what's interesting, those small studies that we conducted doesn't show any relation towards years of practice, age, or anything else. So it's interesting and controversial. We can see that at times nurses with 20, 30 and more years in practice feel quite happy and well, and we see some some younger nurses well prepared but suffering from burnout. So it doesn't depend at times from some specialty within nursing or something. Just recently, among several health institutions, we found out that staff of catastrophic medicine and intensive care medicine, of course, they suffer more, and they more severely suffer from emotional and professional burnout. So thank you.
Okay. Thank you much, Jana, for providing that update. I'll come back to the panelists. I'm going to move on to Aisling Culhane, the president of Horatio, just to ask the same question in terms of the future direction, but in terms of the extent of the issue, and also perhaps what Horatio is engaged in or its members have been engaged in terms of trying to improve well-being of nurses in the psychiatric nurses context.
Thank you, Steve. You can hear me okay?
Yes.
Yes, okay. Good afternoon, colleagues. And as Steve mentioned, my name is Aisling Culhane. I work in the Psychiatric Nurses Association in Ireland, is where my full-time job, and I'm currently president of Horatio, European Psychiatric Nursing. And really welcome the opportunity to collaborate, which is a very important word here today, I suggest, with EFNNMA and colleagues at EFNNWHO and ICN, and apologies if I've left people out. It's lovely to see such a big audience, and you're most welcome to our panel discussion for those of us who are participating. I would like to take this question and look at it through a mental health nursing lens, Steve, if that's okay, just to add a little bit diversion to this specifically. And it's, I guess, what I know best, if you like. And if I were to take the issue of attitudes and values as primary in mental health nursing, this is our everyday, if you like. But within that, what we have come across in our work in Horatio, and indeed I can speak for my own colleagues in Ireland, is I'll throw a few things out that we could look at, but I won't labour them too much. But they are interesting concepts in terms of language. Language can either hinder or enable in our discussions. And if you're coming from a mental health background, you would imagine it is the business of language, as you would. But in terms when it comes for the purposes of supporting staff, etc., there is actually elements of language spoken with, like Mary Rose was talking about in terms of flourishing. These concepts are particularly important because if you look at them in terms of power, in terms of collaborative versus recovery process nursing, which is what we do in mental health, there is a dichotomy across Europe, I would suggest, in terms of different approaches to this. The main goal of psychiatric mental health nursing is working towards that integration piece. But I would say to you that we have quite a variation of how mental health nursing practice is conducted across Europe and the world right now. If we look to some of the areas in terms of proportion of psychiatric mental health nursing in some areas, if we look to Africa, for instance, you're talking about 0.25 of a nurse per 100,000 to those of us who are much more better staffed, which was an issue which has come up in nursing. And within that then is what Jose was discussing in terms of that empowerment piece and working towards the top of our license, as they say, or scope of practice therein. So in some areas of the world, psychiatric mental health nursing is not working, I would suggest, at scope of practice, but that also depends on the level of CPD, clinical supervision, and education resources given to those nurses, which we value and hope to retain going forward. We have a problem with that in some of our countries, and that is retaining the workforce. We also have a problem in terms of how many nurses we train in respect of that. And we have to have an adult discussion on what that means in terms of how we are going to grow our population of psychiatric mental health nursing, retain in those areas to which we train, and develop in areas which have yet to be working towards that integrated piece. If we look at, for instance, if I were to use the concept of mental health technology, and in terms of COVID, for instance, that would have been described as quite a useful tool from when we couldn't do the integrated community piece and go out to the houses and the homes of the people to which we serve because we're in a pandemic. But of course, that depends on whether you have access to e-technology, you have access to the internet as both a nurse or indeed a consumer of the mental health service. And if we were taking that from a human rights and equity perspective, then I would suggest that mental health, whilst a useful tool, is only useful if you have access to it. And so those issues of, I suppose, diversity, inequity, and possibly stigma and discrimination are still alive and well in some parts for mental health nursing and mental health nurses. One of the issues we would have come across in terms of looking at our role in Horatio, having recently published a book with my colleague Nina Kilcoo and Gisli Gifkos and Agnes Higgins, who are former board Horatio members from Advanced Practice in Nursing. Excellent resource for all those. But one of the pieces we would have seen in terms of that is that whole piece of diagnostic overshadowing for those with mental illness or ill health. In other words, that my physical mental health, because I may or may not have a mental health issue, may be overlooked because it's considered part of my mental illness rather than actually the same physical health issue that you might have, Steve. So that piece of diagnostic overshadowing across in many of our jurisdictions is alive and well. And if we are to be holistic and true to the whole collaborative piece, which colleagues have spoken to before, we need to acknowledge that and realise that. But of course, all of this is underpinned, hopefully, by a human rights perspective. And within that, some human rights values are more evident in some jurisdictions more than others. But also there is the role of government in terms of policy. If you don't have a mental health policy and you don't have legislation which empowers that human rights piece, then you're starting from a much lower base in those areas that do have. And with that then becomes the piece that Jose spoke to, that whole competency development piece, working towards advanced practice. So the underpinning elements from a mental health nursing point of view speak to policy, legislation, competency and spokes of practice therein, resourcing mental health nursing, retaining mental health nursing actually in some areas. And that also speaks to that whole employment piece, conditions and all of that. I won't go to the areas of moral distress and injury because we've heard quite a bit piece about that in our discussions today, but they're alive and well, and they are one of the main issues that psychiatric mental health nursing still points to as being an area of concern in its daily work is risk of aggression, risk of violence, that moral distress piece, and burnout also. And it comes to, in terms of nursing staffing levels that we spoke to and Jan spoke to there. I mean, if you do not have sufficient resourcing in the acute units and those units to which you work in, then there perpetuates that issue with regards to sufficient qualified staff, sufficiently competent qualified staff, trained to the top of their license. And in terms of that whole relationship piece and time, which is crucial in our work, that is a requirement, I would say. But in terms of looking, I suppose, in terms of how we are improving our well-being and how we look towards that, I have to say we should look at some of the excellent tools that have been prepared in terms of WHO, in other areas in terms of legislation and the human rights piece. They have to underpin our practice from a mental health perspective every day of the week. They are what we need to do in terms of our fundamentals. I can leave it at that, Steve, or if you wish to.
That's fantastic, and you've answered some of my questions in terms of the issues that are affecting directly the well-being of psychiatric nurses. And I know you mentioned staffing levels as key, which that ties into what Manuel was saying earlier. And probably something that hasn't come out of the discussion yet is around the increasing levels of violence seen against nurses in many countries. Is that something that you've seen across Horatio or even within Ireland where you work?
We have seen it across Horatio. We have seen it in terms of, I mean, it's such a diverse landscape, I would say, in Europe in terms of that piece. But there, if I even take it to the level, we'll say aggression nearly versus violence, you know, these are self-perpetuating, this is a perpetuating line in terms of that. Safe wards is a very useful Len Bowers brought to us back in the early 2000s in terms of looking at that whole culture piece in psychiatric mental health units to try and enable a culture and environment of nurturing, of warmth, of an environment of hope. But one would have to acknowledge the fact, and it would be naive not to, that there are increasing levels in some areas of violence and aggression, particularly where there is issues of drug taking, addictions, comorbidities with mental health pieces. Unfortunately, that of themselves does bring that level to our acute units. In Ireland, we have, and I'll finish at this, and I have presented this before to colleagues in terms of falling out of a long campaign after an actually very serious assault in Dublin. But we have a serious physical assault scheme for psychiatric mental health nursing. So it's an actual insurance-based scheme, which looks to those who have been seriously physically assaulted in the course of their work, who cannot actually work therein because of that. In actual fact, and it's not a secret, this whole issue came out of 3 nurses being stabbed in Dublin back in the early 2000s. And so therefore, the union to which I work for embarked on a campaign to look at something in terms of that piece. Now, obviously, violence and aggression is not all based on insurance-based schemes and compensation. I'm just offering this as the well-being and support for our colleagues when such a situation occurs. Of course, we can't look after those to which we wish to look after if we don't look after ourselves. That's the basic premises where this has come. And we can't have it that we have nurses out of work, in fact, maybe not paid, having been assaulted at work in the course of their duties. And I would suggest that occurs, I know, from colleagues in A&E and various other areas. If we are working towards a piece of integrated care, particularly in mental health, more and more we have nurses working as lone workers actually out in communities. And whilst that is to be applauded, it does bring certain responsibilities on the employer and certain risks that were not there before. And I do believe that this needs an examination from the context of this. If we are bringing care to people's homes, then we do need to acknowledge the fact we are going into sometimes areas that are less than advantageous for work-related issues. We're not talking about the 4 walls even of a hospital in this instance. We are talking about, as you know, going into some areas, some cities and some countries are actually quite dangerous. So, you know, that's a broader discussion. And whilst I don't want to take away from the whole concept of bringing care to the home and integrated care, they are actual realities in the day-to-day working of a community nurse.
Yeah, great. Thank you, Ashley. And just shows into the change in health service, so that also potentially introduces risk as well. Thank you very much, Ashley. I know that Jose has his hand up. I'm going to just let Mervi come in just for about 2 or 3 minutes, because what I want to ensure is that we have representation in terms of the voice of midwives as well in terms of this discussion. So the floor is yours, Mervi.
You think 2 and 3 minutes is enough for midwives?
No, it's not enough. No, it's not.
No. I'm only teasing you. Yes, I'm here sitting as in a panel as a representative of a midwifery association, so Royal College of Midwives UK. And we are actually, luckily, the largest world's organization representing only midwives and now maternity care support workers. So we have a dual role of professional union. And I think this is a key thing for us, well-being. well-being. I mean, so many speakers have said the issue about well-being in a workplace or for our midwives is multifaceted. We can't actually address it in 2 and 3 minutes. And I think we are very lucky as an organization. We are able to collect large amount of data from our members because 95% of the UK midwives belong to our organization. So data is extremely important about their well-being as a starter. But that triggers us to do other documentation and campaigns for actually getting how to get the workforce right, which is about the staffing. We look at the state of midwifery in UK. We look at the state of midwifery education in UK. So we have a large amount of data and documents that we can prepare for either negotiation on national level or local level. But most importantly, our representatives also are there in the local trust. So we have activists who are stewards for union, but we also have health and safety representatives that are in a local organization and region. And this sort of brings me into one of our campaigns, which is about very similar to Flourishing. I was very glad to hear RCCSI talking about Flourishing, because our Caring for You campaign is purely about supporting our members and the midwives that are facing a hard time in their workplace and working environment, which has mentioned several speakers by COVID highlighted this, so the campaign has started. But it's also official. We actually get the employers to write and sign a contract that they're going to improve the working environment and actually the well-being of the midwives in their own trust. Now, you would think logically, Steve, wouldn't you? This is already in our right of our work employment, and there's a big HRs in many organizations. But it doesn't happen. You actually need something external sometimes to make sure that things are actioned on, that they are not just talked about, and there isn't just a nice little contract saying this is what our HR does. You do need it. And we do find that our midwives were burned out early on already because of maybe staffing, but because of COVID, because those extra demands for caring came on. The violence came on because the people that we cared for weren't happy about the caring they had done. But it wasn't the caring from our individuals, it was a system. You know, it's a life event, birth, and people couldn't come in. They couldn't actually come and be with their partner some areas. So, you know, that kind of thing, abuse also increased. And interestingly, it was things like adequate rest breaks, hydrations, nutrition, flexible working hours, all that had to be addressed extra from the normal times. So we did the trolley dashes when people were stuck in one room over 12, 13 hours with no ability to go to have a toilet break because they were one-to-one or water. So we said you have to have, not just have a tea trolley for the patients, but actually have a water trolley for those midwives who are providing care. So just as a simple example, you know, I could go on, but I would also mention, because it was sort of hit me quite close to even what Maggie said. One of the things is that in midwifery, especially, our gender different, you know, sort of balance is high for females and women. And we also knew that there was a large amount of domestic abuse, violence that was increased within the COVID period because of the demands in families and etc. And we surveyed our own midwives about the completely anonymously, you know, so that there was no ability to follow who had answered or whatever, who was actually in the other end of in their domestic life of a victim themselves. Yeah. And they would have to look after people that are victims also. But it just shows that as an association or as us, as for a working environment, we need to be aware what happens also outside those walls. So yes, I think because we've got such a short time, it is just a complex issue, but I think there's these different areas that you can address, different areas where you can help, but sometimes it isn't your employer who directly thinks about them or will be interested because they have their other demands. And we do need association, we do need each other to support. If there isn't an association, form a peer reflection group, form a peer support group, be kinder to each other, because when we are under stress, what do? We insulate ourselves and just about manage to get through the demands of the day. So that's, I'm saying we are all there together, we have to work, but we have to also put some energies on this kind of thing. So I think that's what I just want to say. Thank you.
Thank you, Mervi. And I would echo that issue around the role of trade unions in terms of fighting for advocating for workers' rights in terms of working conditions, both locally, nationally, but also internationally in organizations such as EFN, such as EFNNMA, such as ICN, ICM, and so forth. Yeah, so thank you for that. I'm just going to allow Jose to come in, and then I'm going to come back to Mervi just to close the webinar. Do you want to come in, Jose? You there?
I don't think he can hear you actually, Steve. I think he had a problem.
Jose, do you want to come back in, or shall I move to? No, okay. Okay, so thank you for all of those comments in relationship to various different organizations sort of stretching across Europe from Russia all the way to Ireland, Spain. You know, we've had a range of different views. It struck me that how common the issues were for nurses and midwives across the continent. So I'm going to leave it at that point because it's now 1 minute past 4 Central European time. Just to thank you all for participating, also engaging in relationship to the Zoom and also the Slido as well. And I'm going to hand over to Mervi just to close the webinar.
Yes, thank you very much, everyone. Thank you, Steve, for moderating it so smoothly, and all our speakers and panelists. So I now have my hat as a chair, moving from the RCM, and also as having the pleasure to be the president of EFNNMA. And I hope that you keep your eye on for further webinars, because those will appear regular intervals. I just completely gone out of my head again what date the next one is. We haven't decided on. Oh no, it is actually during our GA. But anyway, all the speakers and everything that we discussed actually highlighted the need of celebrating the European Nursing and Midwifery Week, because that brings us together to share these topics that actually affect our professional and our everyday life. So thank you, everyone, and I hope to see you soon wherever we meet, or maybe on the next webinar online. So bye-bye.